Hello and welcome to Politically Topical. I'm your host, Kevin Jackson, bringing you the latest in national politics and telling you exactly what I think. So let's get into it. Hillary Clinton announced last Friday that she was ready to shed her low profile since the election and come out of the woods. Really, Hillary? It's been 4 months since the election. Bernie lost the primaries and was back out endorsing you in half that time. In fact, Senator Sanders has been in the trenches since the election.
Good evening. Before I respond to President Trump's speech and what he said tonight, I wanted to say a few words about what he didn't say, because when you analyze the speech, sometimes what is more important is what somebody does not say as opposed to what they actually say.
Oh, Bernie, you are a gem, never change. Either way, I'm happy to see the former Secretary of State back on the field. No one else can insult Donald Trump with such finesse. Moving right along. Congress Republicans have released their long-awaited bill to replace the Affordable Care Act, the American Health Care Act. This is the culmination of Paul Ryan's administration. The master plan he and so many others had promised would exponentially outshine Obamacare. But when the bill was released, one thing was made perfectly clear, that it wouldn't. We don't have time to fully break down the bill, but experts agreed that if it's passed, the old and poor will see huge reductions in coverage as the wealthiest Americans receive billions of dollars in tax breaks. I don't know about you, but a healthcare plan that cuts out the old and poor to pay off the wealthy doesn't seem like one our government should be advocating. That's all for now. Be sure to tune in next episode. And don't worry, I'll include a link to the new bill in the description. It's much shorter than the ACA.
For all of the people who have concerns about this, especially on the right, look at the size. This is the Democrats, this is us. You can't get any clearer in terms of this is government, this is not. And I think that part of the reason the visual is important is that when you actually look at the difference, you realize this is what big government does.